So, Ali, welcome to the TechBBQ 2024 podcast.
Thanks, Christian.
We're just getting started at TechBBQ this year. Still early on day number one. Hope you're enjoying yourself so far.
Just arrived, so
Yeah, it's a big venue, so there's a lot to see, of course. So take your time to enjoy both days. So we have invited you to our podcast here at TechBBQ. And I'm so happy you would join us and take the time to join us. And I have invited you because we wanted to learn more about you and about your company as well. So let's kick it off by getting to know you a bit, your background, your educational background, maybe the foundation of how did you come to start this company.
Yeah. Okay. Where to start this? I mean, my educational background, I'm a medical doctor by training.
Mm-hmm.
And during med school, I had a lot of research assistant jobs.
Mm-hmm.
I tried to do research in a lot of different fields, in anesthesiology and cardiology. And I realized there was a lot of problems or at least challenges in the way researchers were conducting their studies today. So that's kind of the inspiration for what we're doing today. But generally I've always had like this idea that I wanted to start a startup. I think at some point I tried to sell secondhand study books, make a web shop for that because it was run on Facebook groups. Yeah, and also I come from a technical family, so I've been looking up to my older cousins and inspired by them. And because I'm a bit of a geek, I started like coding since I was a kid. And all these factors like came together by the end of my study, where especially during COVID, a lot of research happened really fast, and a lot of it like failed because we couldn't follow up with the data extraction. And that's where I saw like, how stupid is it that you hire a medical student, not to like brag too much, but like it's pretty smart, like hire someone that can do a lot for you. But what you make them do is look up in the system, scroll down, find the data, copy paste it over to another system. This was really time consuming and really expensive. I think one of the first examples, someone wanted just to get a study out fast, and he had a lot of money. And I think the pricing was, he didn't want to give an hourly salary because he wanted to do this fast. So he said, for every 100 patients you extract data on, I'll give you 15,000 Danish crowns. And that's where I realized, okay, we need to do this better. And since I know how to code, I could quickly set up a prototype of a solution and showcase that. And I saw the primary investigators of the different trials I was involved in. I mean, they couldn't believe what they saw. They were really excited about it. And then I decided to pursue this as a company.
Yeah, all right. Awesome.
Yeah.
So taking a tedious, boring process and automating it.
Exactly.
Basically. And then doing it within medical research.
Yeah, exactly. But I believe it's more than that because like, at least in Denmark, but also in many other Western countries, we've been collecting a lot of patient data. We have really good structures where we both digitally and on paper, some places, have a lot of valuable data on patients. And this data is just not being utilized good enough. I mean, one thing is for research to get proper insights to know how to diagnose and or to better diagnose and better treat patients. But another thing is like, we live in the age of AI, and to build good AI tools, you need good data. And one of the challenges pre-LLM with what I saw of AI startups was they kind of relied on synthesized data. They kind of relied on non-clinical data because it was too big of a challenge to get.
Yeah, definitely.
Yeah, so basically what we want to do is we want to make sure that all this tremendously valuable data on patients worldwide is utilized to create a better healthcare system globally, whether that's for research purposes, whether that's to develop the future medtech solutions. We think there's a lot of value to be gained in the data.
That's an awesome foundation for a company, really, basically, and it's an area that could use some updating.
Yeah,
definitely. So that leads you to create this company.
Yeah.
What's the company called?
SPEDA.
All right. And how have you been able to utilize your thoughts and processes in automating data processing to create this company? What do you exactly offer, and how do you put it together?
Yes. So the product we have out there right now is a tool that researchers can use connected to their research database, or what's called electronic data capture databases. And we can basically listen in on those databases whenever they include a new patient in their study. Our system will go in the electronic health record system and pull the data from there on that patient and deliver it in their electronic data capture system. So basically, it's just a software they download and press start on, and then they're good to go on their studies. Right now, our solution is limited by. I mean, the reason why we exist is because electronic health record systems, so the systems that doctors use to register data on patients, they're really legacy. They are horrible interoperability wise. And I think everyone who tried to build something for healthcare knows that it's hard to get your medical device to integrate to the electronic health record system so that the doctors can use that data. And the other issue is that the data is unstructured. So basically, the most typical way to register data on patient is by writing a note. So doctors will write, I saw this patient, he came with these symptoms, I asked him these questions, and that's other symptoms I found out. I did this examination, that's what I found out. This is the plan, right? And this is hard to work with computers traditionally.
Yeah.
However, we came in, I would say, at the right time, because the way AI has developed right now, I believe we can handle that unstructured data fully automated, and then doctors can keep on doing what they're used to, and we'll be able to structure the data and utilize it.
Yeah, and if your AI model is able to interpret data from the notes in the medical register systems, of course not handwritten notes, but doctors who type their notes in their systems, if they're able to extract that data and pull that and process that and make some guesses about sickness and health and stuff like that, I mean, that would really lift the ability for doctors to work as they used to.
Exactly.
But get a better database set for knowing their clients, and a new doctor, a new medical personnel, or even a hospital for emergencies will quickly be able to know more about this patient.
Exactly. And that's like a really underestimated use case. And like one example is when I used to work in the ER in Slagelse Hospital, I think the average was spending 1 hour on one patient, like across all us young physicians. And if I looked at my colleagues and myself, like we didn't spend more than 15 minutes with the patient. The 1 hour was used to look through all the data they have in the electronic health record to find the things we needed, and also to like write the notes. The notes has to be written in a proper format, right? And that's also something that takes a lot of time. And yeah, as you say, if we learn how to really utilize AI to understand medical notes, we'll be able to deliver value not only for research, but like for doctors that want to have a quick understanding on what is this patient background. Or,
I mean, in a deal word, basically, at the ER or whatever, a doctor would be able to walk in with their scanner, scan the patient's bracelet with their CPR number on, and know everything they need to know.
Exactly.
Summarized by an AI.
Exactly.
What do we need to look out for? Important history.
No.
Could be allergies and stuff like that. Anything we need to know right now will be summarized by this.
Yeah. And I believe we can cut down like time in the ER per patient with
like
50%.
55 minutes.
Yeah,
5 minutes per patient should be ideal.
In theory.
Yeah.
I still think like being untrained.
Definitely.
You will need to spend
But also
more time
the typing.
Yeah.
You still need to put in data.
Exactly.
By typing.
Exactly. But that can also be automated. Like having a recorder with you.
Yeah, definitely.
Using AI to summarize the examination.
Yeah, and you could record it while examining the patient.
Exactly.
And it will summarize it for you.
Exactly. Yeah. And like the LLMs out there today, prove that this will be possible.
Yes, definitely.
My experience with them, and I think a lot of other doctors' experience with them, are that they are not there yet with understanding health data.
Exactly.
I mean, the typical thing is that I get like synthesized data from an American patient, something that it's trained on that apparently comes up there. But
definitely.
But it shows the way, it shows how we actually can do this. And that's what we're trying to do. So right now with the focus on clinical research, because this is really a market that is struggling a lot with this. They're spending a lot of money on this. And it's a problem they deal with every day. And in the future, we believe there is a lot of use cases for better utilizing the data.
Yeah, well, that's really, really awesome. Yeah. I really, really like the foundation of this company. Working in medtech, I imagine, especially working in an EU country, or even as tight as EU country as Denmark is, you are facing a lot of regulations as well.
Yeah,
some GDPR stuff and stuff like that. How have you been working with those processes, and has it been an issue or an opportunity?
Oh, that's a good question. I would say kind of both.
Yeah.
I mean, the biggest issue for me is definitely the culture that is in Europe with the data regulation, where everyone that doesn't know about it are scared.
Mm-hmm.
So that's like one of the biggest challenges with our customers. They are scared that using us is illegal. And it's not. And that puts a lot of work on our side to convince them that, don't worry about this. It's totally legal. You're not doing something wrong. You got the right backing in GDPR and Danish health law to use this data in this way. But it's also been an opportunity for us, because I think we're the only ones that can deliver a totally on-premise solution. Which for me is at least in my experience, has been a good selling point. I tell them data stays in the Danish regions, never leaves. You got it on your own computer. You got a tool that you can use to transfer data from A to B, but you own the data forever. Compared to I know there's a lot of cloud companies that are really fighting over to get that health data.
Yeah, definitely.
And I, in some ways, at least if it's like a national company, I think that's okay to use cloud services. But I really can see the dangers of, imagine that our electronic health record system was hosted by Microsoft or Amazon. not to say that they don't deliver great tools, but it's just a big risk if someday, and it's hard to imagine, but suddenly the United States are not our friend, but our enemy.
Yeah, definitely.
And they will be able to get to know like the whole health situation in Denmark.
Definitely.
Could be utilized.
Well, we had it some time, not too long ago, maybe a month or two ago, where a lot of systems are built on Microsoft systems, which Microsoft, I believe, was some firewall issue that made a lot of stores shut down temporarily while Microsoft were rebooting their servers.
Yeah.
That could be an issue. Imagine you are in an ER situation.
Exactly.
And your data is unavailable.
Exactly. I mean, that will be horrible. I mean, people will die because of
people would die, definitely.
Yeah. So we need to watch out who we rely on. And in some sense, big companies like Microsoft and Amazon are really good because they're big and they have expertise and you can trust that their stuff will generally work. But the challenge is we tend to trust it too much and don't have a backup.
And it's still a private company.
Exactly. It's still a private company. Yeah. So there is some risks there that I think we should try to mitigate by also making sure we have smaller local companies that can take care of this.
Yeah, definitely.
Yeah. No, but like that's been the opportunity for us saying to people, this data is not going to be in the hands of Microsoft or Amazon, Google.
That's a good point.
It's data you keep on premise, and that has been a good selling point for us.
It is a good. I do believe it's a good selling point. Yeah. So, if I were to wish to learn more about you and your company, how might I find you?
Yeah, I mean, you can follow us on LinkedIn. You can follow me at Ali Al Alak.
It's okay. I'll also put I'll put the links in the descriptions for the podcast as well.
Yeah, and you can follow SPEDA as well on LinkedIn, and we have a website, SPEDA.io. Actually, just updated it. Probably gonna update it more continuously.
Yeah.
And yeah, we try to put our stuff out there on LinkedIn mostly. So follow us there and hit me up if you want to talk about the space.
Awesome. Thank you so much for joining our podcast, to taking the time out of a hectic TechBBQ 2024, and hope you're enjoying the rest of your time here.
Thank you, Christian. Thank you very much for inviting me. It was a pleasure.
Thank you.